Welcome back in. It's getting warmer out. While it might be great for the summer months, for some people it also means sneezing and coughing and trouble breathing. Join us now to talk about managing asthma and seasonal allergies is Dr. Sudhir Rao with the Toledo Clinic. Thanks so much for being with us again. Springtime means pollen's in the air. I know some of my kids have issues with that, the whole thing. And so your specialty is people with allergies and asthma, the whole thing, and detecting actually having it clinically and then how to handle it?
That's correct. That's correct. This time of the year, it's very important to bring awareness like you're doing. And we just want to make sure that they're taken care of properly. A lot of people are having these symptoms, and it's important to understand them so far.
And what's really weird is probably there's a lot of different kinds of things that trigger your asthma if you have it. Do you have asthma, and what triggers it? And then trying to do the test, it's like whack-a-mole to try to figure out what it is exactly that you need to avoid to avoid problems.
Yeah, this time of the year, we're dealing with a lot of pollens, molds. Those are mostly outdoors, and it's important to identify those so they don't bother the eyes and nose, which are caused symptoms of itching and sneezing. When it goes down to the lower part of the airway, start wheezing and coughing, and allergies are a big trigger. 60% of the asthmatics have allergies, and 20 to 30% of people who have itchy eyes, itchy nose have asthma, so it's important to look at both aspects.
Do you grow into getting asthma or allergies, or can they be triggered as you're older, or are they mostly something you pick up as a child and it continues?
One thing is we're not born with them. We develop them as we get exposed, and it's very regional, so different parts of the world have different allergies. Depending on what they get exposed, they can develop allergies based on their genetic makeup. Once the immune system identifies a ragweed or a tree or a pollen or cats, dogs, upon re-exposure, they release certain chemicals in your body, and your immune system every time will react the same way, depending on the exposure and how much you're getting exposed. So,
as time goes on, if you're talking about yourself with your medical needs, is it a matter of how do you know it's that versus symptoms of a cold, possibly? Are they different?
Yeah, most common thing that our individual experience is itching. Colds are going to be more fever, runny nose, but if you have itchy eyes, itchy nose, they're more likely to be allergies that are triggering the symptoms.
Now we have 5 things, simple steps that can help prevent getting your allergies or your asthma triggered. Number 1, keep your windows closed during high pollen days. Take a look at this list and go through them if you could.
Yeah. There's 3 ways that we take care of allergies. One is learn how to avoid them, which is including keeping the windows closed. We always talk about our sanctuary area, which is our bedroom. We spend 1/3 of our life in our bedroom, so sleeping. And that's going to be very important to keep the windows closed, keeping the pets out of the bedroom if you can, keeping air filters, and knowing what season is bothering you. That's going to be important based on your testing and so forth.
And there are meds that's good to treat stuff like this?
Yeah, there are a lot of good medications now over the last 20 years. Most of them are over the counter. And antihistamines, second, third generation antihistamines cause less sedation. They last longer, last about 24 hours, so that's good. Nasal sprays, asthma inhalers are quite a number out there that can benefit significantly. And if those are not helping on a regular basis, then looking for allergy immunotherapy would be the best way to take care for long-term goals.
If you have any information or questions you have about allergies, there is the patient care line, 419-479-5300. That is the Toledo Clinic. Doctor, thanks so much for being here.
Thank you.
Good to see you.
Yeah, good seeing you again.